The case and the presentation on the circadian rhythm was excellent. It was outstanding. I really loved it a lot. Maybe I would just remind myself to put the references always when we have some figures or tables. And also, because of the hypertension, we can also quote the reference of the time trial, which was presented in ESC a few years back and showed that actually doesn't make a big difference what is the timing of the antihypertensive medication. Otherwise, I loved it a lot. Very well done. Very nicely done. Thank you. The presentation on the side effects of statins, beta blockers, and the calcium antagonists was to the point, very concise. The ESH guidelines of 2023 for hypertension put COPD also as an beta blockers, not a contraindication, because actually the usage of beta blockers is quite important, and the main cause of death in a lot of patients like COPD is acute myocardial infarction or ischemic heart disease, and beta blockers are very important there. So we can revise the ESH guidelines. Now beta blockers can be used a lot. And of course, we're waiting at the end of August, beginning of September, the new ESC 2024 hypertension guidelines. You will see that the beta blockers have returned back with more and more indications, not as important as the RAS blockers, CCBs, and thiazides, but this is very. Thank you for your presentations. I love them all. Thank you. About the case that was presented, it's a very interesting case. And yes, we see a lot of diabetic patients with so many comorbidities and peripheral vascular disease. The history was done very well. The cardiac examination, I was surprised because of the high blood pressure, presence of diabetes, that the patient did not have a fourth heart sound. But sometimes it can be heard and sometimes it is not. When we talk about medications, I would have liked to see what type of medications, because sometimes if we have peripheral vascular disease, we like more vasodilatory property medications like the calcium antagonist or the nebivolol, for example, as a beta blocker. When you came to the questions and answers, especially the multiple choice questions, one of the things we don't like a lot is having more than one answer. So this is really not good. You can modify the questions so we can have one answer for each question. This is better than the British way that they sometimes use in the MRCP. And also, please, like the question on the Voroxapar, we don't use it in the Middle East. We don't have it. So it is yani, available in some countries, but we can discard that too. Also, we can, the 10 essential messages from the ACC guidelines are very nice and very long, but we can concise it a little bit more. But overall, a very good presentation and up to date, and really love the way you did it. Thank you.